In the evolving landscape of healthcare, new roles are emerging to meet the growing demands for medical services. In India, one such role is the physician associate, a key player in the medical team who bridges the gap between doctors and patients. Here is the story of physician assistants and the IAPA, an organization dedicated to advancing this vital profession. The journey of physician associates in India began in 1992 at the Madras Medical Mission, where the first PA program was introduced. This pioneering initiative laid the foundation for a profession that has since grown to encompass over 120 colleges across the nation. Physician associates are integral to the healthcare team. They handle routine clinical tasks such as history taking, physical examinations, and diagnostic tests. They assist in surgeries, manage chronic diseases, and provide emergency care. Their role significantly enhances the efficiency and quality of healthcare delivery. Beyond clinical tasks, PAs contribute to patient education, disease prevention, and public health initiatives. They also play a crucial role in healthcare administration, coordinating care, and improving quality benchmarks. The association organizes conferences and workshops to foster professional development and collaboration. They are committed to ensuring that the PAs receive the recognition and support they deserve within the Indian healthcare system. As the Indian healthcare system continues to evolve, the Indian Association of Physician Assistants remain dedicated to advancing the profession and enhancing patient care. Through their efforts, PAs are poised to play an even more significant role in shaping the future of healthcare in India. Join us in celebrating the contributions of physician associates and the vision of the Indian Association of Physician Assistants. Together, we are building a healthier future for all.
The concept of physician assistant actually was made aware to me, or first I met this group of people when I was in the US, when I did my fellowship at the Mayo Clinic. That is when I came to know about this group of people who were extremely talented, skilled, and actually complemented the medical system extremely well. In India, actually the concept of physician assistant was brought in the field of cardiac surgery, and actually it was brought by Dr. K.M. Cherian at the Madras Medical Mission. Till then, this concept of physician assistant was never existing in India. It was from MMM that we had the first lot of physician assistant who were just brilliant students. I am sure some of them would have tried to become doctors, and because of for some reason they were not able to get into the medical profession, they became physician assistants.
In 1987, as you know, we started it in Vijaya Hospital, where we were functioning as Madras Medical Mission with 3 students who have passed their PUC at that time. They were recruited. We approached all the universities. Nobody agreed because they said we have never heard of it. In the end, because of Professor C.V. Ramakrishnan, we started in BITS Pilani 3-year course with 1 year hands-on training. That was a blessing in disguise.
Dr. Cherian's program, to begin with, it is important because it was the first time that it was coming up, and they placed an advertisement telling that it's something between a doctor and a nurse. So that time and even now, there's a lot of craze for a medical profession. So people who couldn't make it to the medical profession, they thought this would be the finest thing, to get as close as doctors to the patients. So that was the attraction. And then we came to know how big a person is Dr. Cherian. So there was another attraction, and working with him, having him teach us in the operation theatre with his own hand, drawing on with the blood and all that, that was a very nice, exciting experience. So to talk about exciting, one part of it, that was the plus point. And the negative, as you know, like people didn't understand about it, and they were discouraging us, telling like, what is the scope for you people? Why did you come and join here? Are you going to be assistant to this or that, assistant of sorts? And they also felt that each of their profession was a threat. Doctors felt like that, nurses felt like that, and there was some kind of a negative vibration going on at the other end. But he was very supportive, Dr. Cherian, and so that's how we could make it. We could complete the program at least. And then because we were so much involved in that, we liked the profession, that we wanted to take it up to a further level, and that's why we started working for the association.
The last 3 decades, we have churned out good number of candidates from Madras Medical Mission alone. When it started, there was always skepticism, what role they will be playing in the healthcare. But Dr. Cherian envisaged, and when we visited US, we saw the PA program in US so strong, and they are helping a lot in the healthcare delivery, helping physicians in so many areas and doing very critical work also. And we were very confident this can be done in India also, and now we are very happy. Our candidates are doing so well, not only in healthcare, they are in the research, they are in the pharma industry and any other related healthcare deliveries, hospital administration, and the avenue has opened up splendidly for these candidates since their base is very good.
In the beginning, people were not very much accepted, but nobody was there to challenge this program because it is between the staff and Dr. Cherian who brought out this program. And then we are also looking at how it grows. But it took up, in a big way when BITS Pilani has entered as a, qualifying university or institute which gave degrees to the completed students.
I had a good fortune to travel with the evolution of physician assistant program in Amrita Institute of Medical Sciences. 2 decades ago, this program commenced in Amrita with a great visionary, Dr. Prem Nair, the group medical director.
We pioneered a comprehensive educational approach by offering undergraduate, postgraduate, and even doctoral programs under one umbrella. Our commitment to excellence led us to start thinking about a postgraduate PA program in India, and today our alumni are making their mark in over 50 specialties, super specialties, subspecialties, both clinical and non-clinical, both working in India as well as abroad. I am proud of our role in organizing the first curriculum committee meeting for PAs, an initiative of the Health Ministry in New Delhi. This was a crucial step in standardizing and advancing PA education nationwide.
Right now, there are no place without physician assistants in South especially and in India, where these people help the surgeons to carry out the regular work. Lot of them do help with the surgery also, doing some major portions of the surgery when they are senior enough. In our theatre, the physician assistant only take the endovascular harvesting, and like that, only PAs do the echocardiography in our outpatient clinic, and cath lab, they do the bulk of the research work and clinical work along with the cardiologist. Like this, we can keep mentioning hundreds of things about the physician assistant program.
And in my own department, there are 10 of them. They are very, very invaluable to the system. We have 2 physician assistants in the OR who are extremely skilled, and I am sure had they done cardiac surgery, they would have been at the pinnacle of cardiac surgery somewhere in the world. We have developed areas because of physician assistants, like the endovascular harvesting of conduits, the radials and the veins. They are done only by the physician assistants. And they have also complemented in other ways to the system in the database, infrastructure, and also developing academics.
I think when we are talking about taking medicine, healthcare to the poor and the common man in villages. I think this PAs will do a great job. Because if you ask somebody who has done his MD, DM and that and this and all, if you ask them to go and stay in a village, they won't go. Because they have spent a lot of money. They have passed out the qualifying examination, but that doesn't mean that they will be in Chennai or they will be in Coimbatore or Salem. But there are so many other primary health centers. My own feeling is that they will be very good in the primary health center because they know how to treat an injury or a fracture. They know how to give IV injection, and they also know how to monitor a patient.
Here, I think the physician assistants form an excellent buffer between the doctor and the patients, where the patients can ask anything that they want to ask about the doctor, about the treatment, about the hospital, about the outcomes, without thinking that it will be an embarrassing question for the doctor. Our acceptance rate for a simple surgery like a total knee replacement, where we have found that the acceptance rates was not very good. It was good, around 80% when but it actually became very high after the physician assistants started counseling them. Because they could counsel them with a good PPT, they could discuss with them, spend a lot of time with them, and then the patients were so comfortable and they didn't have that high level of anxiety when they got admitted. So we use our physician assistants a lot for counseling of the patients. And when you counsel, you need a very well informed person to counsel them. I mean, we don't find that nurses can do that, but physician assistants can do that excellently well. Another place where they are superb, where they are very good for us, is in medical documentation. I mean, documentation, or I can say poor documentation, is going to be the Waterloo of even the most brilliant of the surgeons. And physician assistants are very good in documenting. They are very good in assessing the baseline treatment scores and post-operative scores. And patients find it very nice to see the physician assistants during every one of their reviews. And they are very open to them, they discuss their problems, and they are actually a buffer. They talk to them and then come back and tell us sometimes what the patients want to know.
As regards the scope of this program, I think most of the, or almost all of the physician associates we have trained are in very high positions, and they are applauded to a great extent by their employers. And the future, I think, we should go more into research and sort of refining this program so that it goes in tune with the advancement of the technology. That's what I foresee in future, that apart from the groundwork of patient care, physician associates will get into technology in a big way, and that will make a huge difference.
The first international conference for physician assistants organized by us in association with IAPA was another milestone, bringing together professionals from around the world to share the knowledge and best practices. This event made history and is recognized as an important milestone in the evolution of the PA profession. The Indian Association of Physician Assistants has been instrumental in shaping the profession, advocating for our role, and ensuring that we continue to grow and adapt in a rapidly changing healthcare landscape. As we look back on these 25 years, let us celebrate our achievements and renew our commitment to advancing physician associate profession for the betterment of healthcare in India and beyond.
As far as the curriculum development is concerned, we had a meeting with the officials of the ministry sometime in December 2014. That was the first round of meeting which we had with them. So we have actually been asked to, submit a template. They had given a sample template and we were asked to fill in and give it. So we did that. That was the first step. And then subsequently they asked us to give a model curriculum. And then we were asked to have a task force. So initially it started off with some 10 people and then it increased to 16. And the composition of the task force was like, few of us were from the physician assistant profession, few from the industry. By industry, I mean the medical professionals, and few from the academics. So that was how the task force was constituted. And then the task force worked on getting a curriculum developed. And then the curriculum was discussed and debated. Few changes were suggested. So those changes were also incorporated. And finally that draft has been submitted to the ministry.
The Indian Association of Physician Assistants, the IAPA, has done tremendous job in these 25 years to support the cause of physician assistants and bring this subspecialty of medical science into prominence. I have been associated with the physician assistant program for quite some time, and I have helped them get into the mainstream of the Indian Association of Cardiothoracic Surgery, and we also initiated a certification course for them because they were not part of the allied sciences group of the recognized by the Medical Council or the Government of India. Thanks to the valiant efforts by the IAPA in the last decade or so, I think they are now part of the mainstream. They are part of the allied health sciences according to the approval that they got passed in the parliament a couple of years ago.
I am very proud to say this program has come to stay, and the healthcare industry will recognize them very soon with more accolades. IAPA right now have about 600-700 members, and maybe thousands more are out of IAPA. I request all the physician assistants to enroll in IAPA so that the association becomes much stronger to represent the whole community of physician assistants so that they can achieve and gain a lot of things.
In the last 25 years, it has grown strength to strength, and this year, the 20th IAPA conference is going to be held at Madras Medical Mission, and it is of great importance that this program is showcased in its true requirements and its true importance. There are currently about 600 PAs in the association and many more outside who have not registered with the association. I hope this conference provides the momentum for all the PAs to get registered in the association so that their strength increases, so that the states can then get the paramedical courses recognized and improve the quality of care of health services in this country.
And I'm pleased to share with you about the involvement that IAPAE has with the Indian Association of Physician Associates. We first developed a relationship in 2019 when I was invited to be a keynote speaker at the India Association of PAs conference, which was held in Mumbai, India. It was such a pleasure to visit and meet colleagues and share the wonderful work that IAPA is doing around promoting the physician associates in India. IAPAE at the time helped support the IAPA for the proposal of the Allied Health Professions Bill, which I'm so pleased has now passed in your parliament and is forging the way for IAPA to be recognized as an association with the development of the PAs in India through the development of the Allied Health Professions Council and what will be the registration of the PAs in India. IAPAE has been in existence as an organization since 2007. We are a group of dedicated educators that support the global movement of PAs. As you may be aware, PAs, physician assistants, also called physician associates, also called clinical associates or clinical officers or Feldshares, are found in over 80 countries around the world, and we have 35 different practice titles. But we come together with one voice, and we're unifying under one global title, which we call clinical practitioners. So I'm a clinical practitioner, and I'm registered as a clinical associate in South Africa. I'm also registered as a physician associate in the United States, and I was registered as a clinical officer in Kenya, where I practice medicine. We are really looking forward to the partnership that we're developing with IAPAE and with IAPA. And I wish you the best of luck in your conference coming up and much good work as the PAs in India work towards promoting primary health care and surgical work for the citizens of India. I thank you so much.
I wish them all success, and they should grow more and more scientist program has to come into the thing, because like Make in India, Atmanirbhar program in India, these people have to cover that place where they invent new things for supporting the surgical program or a medical program.
The IAPA, as I know, I have been associated with them for the last, close to about 15 years. And we have hosted at GKNM a couple of meetings in Coimbatore, and I see that this organization taking a very good structure. And this year there is a new leadership. The previous president did a great effort in getting the IAPA consolidated, and he was instrumental in getting the allied health program in. And the current team has to take it forward. And I'm sure with great support from all areas of the healthcare sciences where they are now prominent, I'm sure this association, the Indian Association of Physician Assistants, is bound to grow and achieve great heights. I once again congratulate, and my only wish is IAPA focuses on education, academics and research. And I am hoping that IAPA will come out with a medical journal like the American Society of Physician Assistants, where all these people can contribute so that their work is well known to the outside world. My best wishes to IAPA on their 20th annual meeting that is coming up in Chennai, and wish IAPA a very, very fruitful 25th Silver Jubilee year. And I hope that PAs will continue to lead the healthcare system and play a very, very important role in all the specialty of medical sciences.
The IAPA extends heartfelt gratitude to the many key figures in the Indian healthcare system for their unwavering support as sponsors. These distinguished leaders have played a crucial role in the association's achievement. They continue to provide valuable guidance to the IAPA. The current standing of PA profession in India is a testament to the tireless efforts of numerous PA leaders who have championed the profession's interests. These leaders work relentlessly to elevate both the IAPA and the PA profession with a shared goal of advancing quality healthcare in India through PA, while also safeguarding the rights and interests of the PA community. Their dedication has paved the way for greater recognition of the profession and its growing impact on healthcare delivery across the country. While the IAPA has achieved significant milestones, there is still much more to accomplish. Join us in our mission for a healthier India. To become a member of IAPA, please visit www.iapaonline.org.